You're listening to Coupled With, the podcast that helps you take the guesswork out of feeling seen, heard, and valued in your relationship. If you've ever felt stuck in the same arguments, struggled to stay connected, or wondered how to better communicate with your partner, you're in the right place. I'm Dr. Rachel Orleck, a couples therapist and coach, and together, we're going to make relationships make sense. Let's dive in. Pregnancy loss and infertility can be incredibly isolating, and many couples struggle to process the grief together. Today, we're talking with Dr. Julie Bindeman, a reproductive psychologist, about how to navigate this heartbreaking journey. In this conversation, we'll discuss the impact of fertility on support, intimacy, and connection in the relationship, ways to support yourself and your partner, and how to be a support for those going through this. Dr. Julie Bindeman specializes in infertility and pregnancy loss and has worked with countless individuals and couples who are facing these fertility challenges. I'm very grateful that she's bringing her wealth of experience to us today. She's a member of multiple organizations focused on maternal and reproductive mental health, is involved in training other therapists and psychologists, and is an approved consultant for EMDR. She is the co-owner of Integrative Therapy of Greater Washington in Rockville, Maryland. And she is just a very strong advocate for individuals who are going through this experience. Let's get into this important discussion. Hey, Julie, welcome to the show. It's so nice to have you here. We are going to be talking about pregnancy loss and couples who are going through infertility. What are the things we need to be thinking about when there is a couple who's been going through this? What do couples need to know?
Sure. Well, first of all, thank you so much for having me. I'm so excited to have this conversation with you. Um,
Thank you.
I think that when a couple goes through infertility, that tends to be the first kind of crisis that they experience as a couple when we think about what the age is for reproduction and when people tend to get married. So this is a general statement,
Sure.
certainly not for everyone. And certainly there are couples that have had other kinds of crises, maybe in parts of the couple have had an issue that the partner has then supported them through. But typically, this is the first one where both are impacted.
Mm.
And then if you add to it pregnancy loss, it's like a double whammy. So it's okay, first we have to go through infertility and it's the cost of it and the time of it and just all that it brings on a couple, the effort of it, only to find that yay, it worked. And then for whatever reason, oh, that baby that we have been imagining since they shared the embryo photo with us is not the baby that we're going to welcome, is not the baby that we're going to raise. And what tends to be so hard is most couples have talked about what they see themselves like as parents, the things they want to share with children, what they're not going to do as parents. And so they've already mapped it out, and so for a loss to happen, it means it's just kind of a severing of that map up until potentially they have another child.
Is there a difference when couples are already going through infertility and experiencing a loss versus couples where that loss is kind of the start of their infertility journey?
Yeah, I think for those going through infertility, and again, it depends upon how long they've been on that journey for, but they might be really well aware of the peaks and the valleys of the journey, that things don't always work out, that things are not always easy. And so in some ways there's a little more resiliency, particularly couples who have gone through lots of transfers that might not have worked. That first one to work, um, there are some who kind of guard themselves and they're like, well, this hasn't worked before. Let's be cautiously optimistic. But there are others that are like, oh my God, it finally worked. Versus a couple who was able to conceive on their own only to have a miscarriage, I think a lot of times people don't realize that pregnancy loss is a possibility and what I like to say a normal outcome of pregnancy because it happens so much more frequently than we think or we know or we talk about. So I just want to kind of normalize it in that
Yep.
kind of way. And it's so unexpected because I think a lot of times the conceptualization around pregnancy is, well, if we stop birth control and have a lot of sex, we're going to get pregnant. And as soon as we get pregnant, 9 months later, we have a baby. And
Mhm.
there's no knowledge around all of the different things that can happen within that 9-month period.
There's so many potential complications that people just aren't talking about before they get pregnant.
Right. And for some ways, like that might be a good thing because if I had known all of the complications for me or all of the negative outcomes that might have happened, I don't know that I'd want to get pregnant. And because it would feel like that's an inevitability versus these are the like the not often circumstances, but still they're not never. So we want to tell you about them. But there can be other reasons that people have miscarriages, such as um, issues with how the uterus is constructed. There might be immunological issues that are going on. There's so many different things that can happen too. So i- it's one of the hard parts about pregnancy loss is that it can't always be determined the why.
Mm,
When we think about other losses, because miscarriage is certainly one kind of loss, but not only the loss one can
sure.
have. And just to make sure people know what I'm talking about with a miscarriage, it's a pregnancy loss prior to 20 weeks gestational age. Stillbirth is another kind of loss people can have, and that is a pregnancy loss after 20 weeks of gestational age. That's another time where people might not know what caused it. It might have been a cord injury. It might have been some kind of genetic issue that had been undetected. There's so many possibilities for what that is, and oftentimes parents don't get that answer, and that can be really hard as well.
How does going through a pregnancy loss like this, whether it's a miscarriage, so before 20 weeks, or a stillbirth after 20 weeks, what issues do you see come up in the couple, in their relationship?
Um, I think one of the things couples have at the beginning of a loss is that they are in lockstep with one another. They are just absolutely, they're sad, they're devastated, they're feeling some of the same things. And what tends to happen is at some point, as time progresses, they deviate from sharing those reactions to having really different reactions from one another. So typically, there's someone in the couple that's an instrumental griever, which means they're a doer. And then we have an instinctual griever. So that means they're more of a feeler. Uh, This tends to be really gendered. I'm using these words really intentionally to try to ungender what these roles could be because I've seen it always.
Mhm.
And it can be really hard to understand why is my partner spending so much time doing X, Y, and Z while I'm over here talking and crying and researching about this loss? Like, why do they seem to be unimpacted by it? But when you talk to them, they're like, no, I am impacted by it, but this is the way I work through it.
Mhm.
I need to create, I need to put something together. I need to feel like I am being generative in some way.
Absolutely. Have you seen differences in how the grieving process works between hetero couples and non-hetero couples?
Yes, and I'm so glad that you asked about this because we tend to lump every couple as the same, and then this is how they must grieve. So with same-sex couples, queer couples, for the majority of them, I don't want to say all, but for the majority of them, they have to use some kind of assisted reproductive process in which to get pregnant because they either don't have a uterus, they don't have an egg, they don't have sperm. or maybe a combination of those two. And so there's always that financial piece that goes into every pregnancy. I wish that wasn't there, but unfortunately, for often too many couples in this country, it is there. So to know that it's a loss that tends to be far more shared in terms of experience, even with the non-gestating partner, because the dream is so connected. This is a project that they've really been on together, and it's such a thought experiment up until you go through the reproductive technologies. There's a lot of thinking that queer and same-sex couples do prior to even engaging in this process. And so that sense of being a parent is kind of started to form way before a pregnancy has even occurred. So there's that sense of identity that gets lost. I think also there can be the sense of um, with heterosexual couples, often they're at reproductive age, just like their other friends are, and they're sort of all going through it together. With same sex couples and queer couples, that might not be the experience. So there might not be other people that they can lean on who have had the experience of loss. Or they're seeing that everyone else is not having an issue with this, but we are. And I think what's really important too is that for most queer couples and for most same-sex couples, medical infertility is not part of it. It's again, there's an ingredient missing or several ingredients that might be missing, and that's why they come to assisted reproduction. But it's not because there is a medical reason. Now, in some cases, there might be a medical reason on top of not having all the ingredients. So it's a different experience in terms of how they approach assisted reproduction too.
Yeah. So it sounds like, and please correct me if I'm not getting this right, but it sounds like with hetero couples, there's this tendency to almost have it be like, yeah, this is just the process. We're going through it with our friends. And then we hit a snag or a hitch somewhere, and now we have to start really planning and thinking about it. Whereas for non hetero queer couples, same sex couples, you they really start planning for it well ahead of time, and it becomes much more ingrained before that pregnancy might even happen.
Yeah. You absolutely nailed it. So
So, what about for couples who might be experiencing a pregnancy loss as their primary infertility versus secondary infertility? And for anybody who's not familiar with those terms, primary infertility would be never having had a live birth and starting out with infertility, and secondary would be already having a live child and then experiencing infertility.
so I think even the premise of the question is complicated because when you've had recurrent pregnancy losses, applying the label of infertile seems to be a contradiction because people will say to me, but I don't have a problem getting pregnant. I just have a problem staying pregnant. Unfortunately, the American Society of Reproductive Medicine in 2023 expanded the definition of how we understand infertility to be inclusive of that experience of recurrent pregnancy loss, where it's not attaining pregnancy that's the issue. So I'm very appreciative of that. Um, the challenge in primary infertility is, will we ever have a baby? And when we have these losses and we have infertility that's associated with it, perhaps it's really that feeling of we might never have a baby, or we might never have a baby that is an equal representation of each of us. And so that in and of itself is a whole other loss.
Mean equal representation, meaning maybe having to use donor sperm or donor egg.
Right. So equal representation meaning, hey, we're using the sperm and egg of a cisgender couple versus, oh, we need someone else's ingredients in order to make this work.
Mhm.
Um, I think the difficulty with secondary infertility is more how others respond to it versus how the couple responds to it.
Oh,
So
interesting.
in a way, others respond to it as, well, at least you have one or two or three or four, however many children that couple might have. Because
Sure.
secondary doesn't mean it's just your second kid that you're struggling with. It could be your fifth kid and everything was fine for the first four, but the fifth one is really hard. So,
Not to
um,
mention when someone says, at least you, it
exactly.
automatically invalidates anything you're going through.
Absolutely. So that's exactly what I was going to say is people will offer comfort. I'll put air quotes around that with the idea of, well, at least you have one, two, three, four, five kids. And it's like, yes, and that doesn't negate me wanting another or me seeing my family complete in a different way. So I think that becomes one of the big challenges or sort of a surprise around like, oh my God, you're doing this again, particularly if you have um, several children already. I think also what can be really hard is the lengths in which someone might go through with secondary infertility. And then again, the external feedback is, you know what, just be happy with what you have. Like you're putting yourself through so much and you don't have to because you already have a kid.
That's so
Again, well-meaning.
unsupportive.
Well-meaning, well-meaning. Um, and it's like, you know what? I think everyone knows they have an option to stop, but that is not the choice they want to make. So
Yeah.
again, being able to understand that people on the outside might not really understand what's happening.
So when there might be that lack of support on the outside, and that can be true of any point in infertility, because as society, we tend not to talk about it very much. So we may
Also,
keep it hidden.
we suck in terms of anything that has to do with loss or grief. So there's that.
Yeah, it's just do it on your own, figure it
Right,
out.
right. Don't be emotional around me. I don't know what to do.
Yep. I used to, when I worked in the health field, specifically like in clinics, we used to say that doctors can handle any fluid except for tears.
Yes, that, yep. And I would say that, yeah, tears are is a fluid that most humans have difficulty
For
managing.
sure. Leads me to another question, which is once couples have had a loss and then they go on and have another pregnancy, even a successful pregnancy and live birth, but during the pregnancy, the impact on the couple, because there has been that previous trauma and grief, and now they're going through it, and maybe one or both partners are extra vigilant.
Yeah, there's tends to be in a subsequent pregnancy after loss. Anxiety is a feature, not a bug. Like it is just what is pervasive. And that can be really hard to the non-gestating partner because they're like, hey, but it's fine. Like it's going to be fine. And the person who's pregnant's like, well, maybe it doesn't happen in the first 3 months like it did last time, but that doesn't mean that the rest of the pregnancy is fine. Like I think sometimes too, in seeking out support, we inadvertently expose ourselves to way more forms of potential trauma than we mean to. So, hearing about other people who have had losses all across pregnancy starts then to make it feel like, wow, pregnancy is a minefield and no one survives it. And how do any of us ever have babies anyway? Versus hearing the more frequent stories of, yeah, I got pregnant and I had a baby and there was no issue with it. Um, so it's sort of really hard to know what is real.
Mhm.
um, so that piece can also be really complicated too, and not understanding the anxiety around it. And oftentimes that anxiety, it might be associated with trauma, but I think it's also important to note that not everyone experiences miscarriage as traumatic or as a grief experience. Some
That's true.
people experience it just as a, this happens, on to the next.
Yeah, everybody has their own understanding of pregnancy, their own expectations, and especially if they've had difficulty getting pregnant or they are going through this and they know all the risks, then it could either impact them more or it could impact them less.
Absolutely. Yeah. And the conceptualization of what when a baby is a baby differs for everyone too.
For
um,
sure.
so that's another piece of it where There are people who feel like they're not allowed to mourn if they've had a chemical pregnancy or if they've had like a really early, like a missed miscarriage, um, or an early miscarriage. There's this sense of like, well, it wasn't much anyway, and I'm not allowed to mourn. But being able to mourn again, that dream that's already been taking
Yeah.
hold, that's the part tends to be mourned.
That becomes really disappointing. And there's grief associated with that because all of a sudden you started imagining the clothes you were going to buy and the nursery you were going to build. And all of that occurs before that first blood draw.
Yeah. Or how am I going to share this with my partner? Or how am I going to share this with our parents? When are we going to tell people? What's it going to look like for me to show? Like,
Yeah.
am I going to feel like you're planning so much of it? You have questions that you're excited to find the answers for.
Um, so when they're not experiencing that external support, but so they really only have their partner to lean on, what kind of tension or friction can come up as you're needing support, but you're also going through your own grief and processing?
Yeah, so what becomes really challenging is typically, as I said, there's this instinctual griever and there's an um in oh, thank God, I'm blanking on the word. And I just used it, but an intuitive griever and there's also an instrumental griever. And the instrumental griever doesn't want to talk about it. That's not how they process it. And they have to be there for their partner. And if their partner really needs to talk about it, they're not going to feel supported by their partner because they're not getting what it is they need. Neither one of them are actually getting
Right.
what it is that they need. And so there can be some resentment. There can be a sense of, you just don't understand me. Why are we doing that? Like to an extreme, it might be, why are we even doing this if we can't understand each other right now? How are we going to manage as parents if we can't manage this right now? And so often, what tends to be a useful way for people to handle this is to seek outside support. So maybe that's a peer group or a Facebook page, or maybe that's individual therapy, or maybe it's finding that distant friend who's kind of gone through something similar. So you have someone to talk to. Because it's really hard to have an experience that is not a normed experience. As I said, I normalize it, but that doesn't mean that others do. Um, and not being able to get the support from people who have been supportive in all sorts of other experiences. So there's another sense too of confusion or loss in that. And it can be really hard to have to be the explainer, to have to sit there and be like, okay, so we're going to have to go through IVF now because apparently we both carry a gene and it's catastrophic. And so we know what it is, but we need to create embryos that don't have that gene in it. And parents like, IVF, what's that? Or, people that just don't understand. And it's like, "Oh, can you research it yourself? Because I'm exhausted and I don't want to explain it."
Yeah. That's such a hard thing to do when I know when I was going through that and I was trying to explain to my family what we were doing, just wasn't the understanding that in my case it was embryo donation and it was just there wasn't the understanding that that was even a thing. What does that mean? How
Right.
are you going to do that?
Yeah.
And it
Do
was
you just buy it
exhausting.
at the store? Right. Like, how do you find them?
Yeah, it's on aisle 6 in the grocery store.
It's in the freezer section.
Yeah, exactly. Right next to the other eggs.
Right. Right. There's sperm, there's eggs, there's embryos. Pick what you want.
So, as couples are going through this and they're really wanting to be each other's supports and they're not wanting this experience to separate them or cause more friction, especially if they're going to need to go through additional fertility treatments. What are things that they can really do to stay connected and to stay supportive of one another?
Think there's a lot that they can do. Infertility can be so disrupting to life, and it can feel like you're a full-time patient. And so you feel more disconnected from yourself because there's a lot to track. There's a lot of scheduling and there's a lot of timing involved in it. And there's a lot of having to forego what you want to do because of the timing that might be involved in it. Um, so what I like to say to people is like, you are who you are, regardless of what treatment you need to go through. And how do you hold that identity too? Because that's an identity that quickly gets lost.
Mhm.
So what are the things you can do that where you can stay connected to yourself? If you're someone who loves to go on runs and maybe that's not what you can do during treatment, okay, can you go on walks? Can you be in nature? What are something you can do to, again, still stay connected to yourself? I think for couples, one of the best questions you can ask the other is, before you go further, do you want me to listen? Or do you want me to help problem solve? And give your partner the chance to answer it and then do as they asked. Don't be like, oh, they want me to listen, but I'm going to problem solve. Like, no, 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 that's not
Mm.
what they asked for. And I think this goes both ways because it can be useful for anyone, particularly one who's like, actually, I need to problem solve this. So I want to tell you about it. I need your help to problem solve it. Okay, I can
Yeah.
help you do that then.
I can imagine that there could be some tension around that when there's the instrumental and intuitive, and then the instrumental person wants to figure out what the next step is, and the other person's like, but I'm not done with this step yet.
Right. But particularly if the next step involves donor gametes. That can be really hard. Where particularly the person who will still have a genetic connection potentially to the child is like, let's go. And the other person's like, hold on a second. This is a whole other loss I have to grieve here. Like, I'm not necessarily ready to be where you are. I need some time to sit and feel this loss because it is a huge loss for me.
Yeah.
I think another part that gets really challenging, particularly with infertility, but also with pregnancy loss in general, is sex. So, certainly during infertility, there are certain times in a cycle where you can't have sex or you don't want to have sex. And so being able to think with a couple about how else do you all show intimacy if it's not about potential penetrative sex? Like, what is that like for you?
Mm.
How might that be something? How can we think about that together? And
Really
with
expanding the definition of what sex is.
yeah, absolutely. And with pregnancy loss without infertility, where the difficulty tends to come is, but I don't want to have sex because sex means pregnancy, which means loss. And so there's that through thread that gets created that sex means loss. And that then can be really hard. It's like, I don't want to go through that again.
That
So
can be
again,
really traumatizing on the body, and then your body shuts down and won't come alive to
yeah.
pleasure.
Yeah, exactly. And I think we forget that sex is not just about procreation, particularly when we're in that procreative phase of life, but sex is about pleasure, sex is about connection,
Mhm.
sex is about play and enjoyment. So there's so many more things that get attached to sex that's not only, its procreative nature.
Sure. And you mentioned times that you can't have sex because of artificial reproduction, but there's also people who are using medication to enhance fertility, and they have to have sex during certain times when
Yeah.
their bodies may not want to.
Yeah, absolutely. Or in terms of the partner who might have to be the one producing sperm, having to do so if we're doing a fresh egg, a fresh transfer, creating fresh embryos to transfer, which isn't done as much anymore. But, that then means that there is a demand for sperm at a certain point because we can't have sperm outside of the body for too long. So that creates a pressure. There can be a demand pressure too if we're looking at timed intercourse or accentuated time intercourse where we might be using some medication. And again, that's like, we need to have sex now is not the most romantic thing for someone to say, like,
Yeah.
Yeah, so that and then that can be another area of friction, which is like you weren't able to do the one thing I needed you to do. And the other person being like, "Well, I can't always do it on demand."
Yeah, the pressure to perform is so hard, especially if you're getting called home in the middle of the day because all of a sudden your partner is ovulating,
Yeah.
or if you're having to figure that out. It is surprisingly unsexy, I am told.
Yeah, it's really, really hard. And it might mean that, I mean, even for couples not experiencing infertility and are just trying to have a baby, the more often you try to do that and you're not successful, like the more vigilant you are around timing, the more you're
Yeah.
looking at, well, what are the variables? And if you're both on the same page about that, yeah, that feels really unsexy. So sometimes one partner has to be like, I can't let him know I'm ovulating right now. I just have to have him feel like I just really want him right now. And it not so that that performance piece isn't attached to it.
Yeah. Yeah. Is there anything else that I haven't asked directly about that feels important for our listeners to know?
Yeah, I want to say a little bit about how to support someone who's had a pregnancy loss.
Yeah.
Because again, we don't do so well at that. I think you need to take their lead in terms of the language they use. So if they've named their baby, use that baby's name. If they're calling it a baby, you're calling it a baby. If they're calling it a fetus, you're calling it a fetus. Um, I think it's useful to do versus to be like, let me know what you need, because you know what, when you're grieving, you don't know what the heck you need. So it's really hard then to have that functioning of, well, let me figure out what I need and then let me assign you a task. So being able to volunteer, hey, would it be okay for me to pick up dinner for you tomorrow? Oh, yeah, that would be great. Okay.
Yeah,
Hey,
that's lovely.
would it be okay for me to come over and like maybe do some laundry or just hang out with you? Oh, yeah, that'd be great. Hey, why don't you and I take a walk? Oh, that would be great. We can talk about whatever you want to talk about. I'm not gonna make you talk about something that maybe you're not ready to talk about or to talk to me about. So please, please, please don't ever offer something you are not able or willing to do. My favorite example is I had a clergy member call me after one of my losses, and he's like, anything you need, whatever, here to talk. And I'm like, oh, great, I'd love to talk. And he then tried to push me off the phone. And
No.
it was so frustrating. I mean, it was really on brand for that person, but it was so frustrating because I'm like, you offered. Why do you offer if it's not a true offering? So
Sure.
don't offer if it's not something that you can do. Did you give the baby a name? Um, talk to me a little bit about it. Being able to talk to people about the memories of pregnancy they have, because those are all the memories they've got of this child. And that's also what's really hard is, it's not a person who has died that lots of other people knew and we can now share stories about, but it was this very unique time frame in which that baby was known, and it was a very narrow window in terms of who knew them. So being able to talk about that. So certainly when I'm with clients that experience later losses, I start asking about the pregnancy. Well, how did you find out? How did you tell your partner about it? How did you tell family about it? What was that like? What were the things you were excited to do? What was that first ultrasound like? What was that, anatomy scan like for you? Really asking the questions, because these are where the memories are.
A lot of
And
people are scared to ask these questions because they think it'll bring up more of the grief, but that's actually what helps people process it.
absolutely, it's being forced into silence for the majority of people. Again, not everyone, but for the majority of people, being forced into silence is really hard. Is the like, okay, we're not going to talk about the elephant in the room. Um, And I think it's okay just to be honest, to say, I am so sorry to hear that this happened to you. And I wish I had more words that could bring comfort, but I recognize there are no words.
Yeah.
Yeah, you know what? That's honest.
I think I might even also add that the grieving period lasts longer than we think it might. And
Yes.
so
It's not 2 weeks.
no. So there's tends to be this drop off in support and comfort that happens that is
Yes,
really difficult
yes.
for that couple or that individual to handle.
When people ask me when they're trying to support people, they're like, "Well, what can I do?" I said, "Well, the first thing you can do is you can mark on your electronic calendar, set it as a yearly reminder when that baby was born." So even if they were born still, you have that time of when they're born. So the next year you can reach out and say, "I just want you to know I'm thinking about you on your baby's birth, on what would have been your baby's birthday. I just want you to know, like, today might be a hard day. And if you want to talk, I'd love to talk."
Yeah. They just need to know that they're not forgotten.
Absolutely, because it's the parents, and particularly the person who carried, who tends to try to preserve that memory. And not all the time and not all the families, but that's also a space that's really hard is how do I preserve the memory of the child that wasn't versus the children or child that
Yeah,
are, that is or that are.
absolutely. That's such an important point and so important for people to be thinking about. And also, if somebody's listening to this and they are the person who has experienced the loss or the couple that has experienced the loss, being able to share maybe this episode or share your needs with the people in your life and say, hey, I'm not always going to be able to ask, but this is what I'm going to need from you.
Yeah, absolutely.
Well, thank you so much, Julie, for coming on the show and talking to us about this really, really important topic.
I'm so grateful you had me. And again, I'm always happy to talk about these kinds of things. So thanks for having the courage to talk about something people don't want to talk about.
Oh, absolutely. I hope that this is a show and a podcast that will bring understanding, awareness, and comfort to a lot of people. That conversation was so powerful. And I just love how Dr. Bindeman highlighted the importance of really seeking to know what your partner is needing in that space because we all deal with grief and loss differently. So, assuming that your partner needs exactly what you need at that point in time can actually create more of a disconnection in your relationship and, in fact, lead to feeling less valued, less understood, and less connected, which isn't what you want at this stage as you're thinking about trying again, as you're going into infertility treatments. You want to feel as secure and connected and loved as possible. So, really making sure that you are asking what your partner is needing and keeping in mind that sometimes it's going to be a little bit different than what you need. And also being able to seek out comfort and help outside of your relationship can actually make you stronger inside because one person is not going to be able to meet all your needs going through this. So, if you or someone you love is struggling with pregnancy loss or infertility, I highly encourage you to check out Dr. Bindeman's website, which is again Integrative Therapy of Greater Washington. The website is greaterwashingtontherapy.com. If this conversation brought up some emotions for you, know that you're not alone. Grief and healing take time, and there's no right way to go through it. If you've been nodding along during this episode thinking, this is exactly what happens in my relationship, but I don't know how to stop it, I made something for you. It's a free 7-day email course called Break the Cycle. Each day, I'll walk you through simple steps to stop the same fight from repeating and start rebuilding real connection without shutting down, walking on eggshells, or trying to do it all perfectly. You can sign up at my website. I'll link it in the show notes. It's totally free. This isn't just about communication. It's about breaking patterns that are breaking you. That's it for today's episode of Coupled With. Thank you so much for spending this time with me. If this episode resonated with you, I'd love for you to hit subscribe so you never miss what's next. And if you found it helpful, please share it with a friend or leave a quick rating and review. It really helps more than you know. And if you're curious about how we might work together, or want more resources to strengthen your relationship, head over to my website, www.drrachelorleck.com. You'll find free tools, podcast extras, and ways to go deeper. Thanks again for listening, and I'll see you next time.